Welcome back to this week's episode of Healthcare Heroes. Today I'm joined as usual by co-hosts Sam Soulias and Ryan Brenner.
Good afternoon. This week we'll be discussing the relationship between total health spending per person and infant mortality rates across multiple countries. We're defining infant mortality as deaths of children during the first year of life per every 1,000 live births. Total health spending per person is the average health expenditure per person expressed in international dollars. This already brings up some interesting factors, as some countries differ on how they define infant mortality. For example, the US considers a baby born after 21 weeks and weighing less than a pound actually born, while other countries would not and instead consider that a stillbirth. So these babies with relatively low odds of survival end up counting towards the US's overall infant mortality rate.
Interesting that you say that, Sam, as premature births are the number one factor in explaining the United States' high infant mortality rate. Preterm births have many different causes that stem from maternal issues such as high blood pressure, diabetes, Zika, and other infections, which many times are not necessarily within an expectant mother's control. The major issue here is the lack of universal access to quality prenatal care. As 50% of pregnancies in the US are unplanned, so many women may not be aware that they are pregnant in time to get early prenatal care, which may also attribute to the high rate of premature births in the US. Understanding these different potential factors is important as it allows us to think a little deeper about current global trends in infant mortality. In order to help us explain the relationship between total health spending per person and infant mortality, we have an exciting new tool for you guys called Gapminder. This tool will allow us to observe how this total health spending has seemed to have affected infant mortality over the course of 15 years. But don't let that fool you. This tool only lets us see the relationship between two variables. In reality, there could be a variety of other factors which could affect global infant mortality rate.
At first glance, it is clear by looking at the Gapminder graph that there is a negative linear relationship between total health spending per person and infant mortality. As seen in the graph, for the purpose of explaining global infant mortality rates, the x-axis shows our independent variable of interest, which is total health spending per person, while infant mortality can be found on the y-axis. Within the linear shape of the graph, it is noticeable that many African and Asian countries show higher rates of infant mortality. With less disposable government funds that can be allocated to healthcare spending, many countries in these two continents lack the proper resources necessary for caring for their young. At the other end of the graph, we can see how many countries belonging to the Organization for Economic Cooperation and Development, which is also known as the OECD, and other developed Western countries having significantly lower rates of infant mortality. This makes sense because these countries tend to have plenty of funds that can be used to provide adequate health care. As we can see, when observing our Gapminder model over a 15-year period, there is a constant negative linear relationship between total healthcare spending and infant mortality as time progresses. It seems then that there is in fact a correlation between these two variables. As a general trend, countries experience lower amounts of infant mortality when there is more money going into their healthcare system. However, there can always be exceptions to any rule, and Sam will now explain why the US is an exception.
It really is an anomaly how the US has the worst overall child mortality rate compared to the other 19 wealthiest nations out of the 35 in the OECD. Doctors and researchers alike are alarmed by how far the US has fallen behind other wealthy countries. Dr. Ashish Thakrar, lead author of a study on infant and child mortality rates within the OECD, found that across all ages and in both sexes, children have been dying more often in the US than in similar countries since the 1980s. The research showed that while childhood mortality rates declined gradually from 1961 to 2010 for the US and the other 19 most wealthy nations, which was overall a big success for public health, the US rate fell at a slower pace than the other nations over those 50 years. Between 2001 and 2010, researchers found that the mortality rate in the US was approximately 75% higher for infants than the average rate calculated for all of the countries in the study. Iceland actually had the lowest infant mortality rate among all the countries within the OECD. Iceland spent only 8.7% of their GDP on healthcare, which was actually lower than the OECD average of 8.9%. The US's health spending was a whopping 17.2% of their GDP, more than double that of Iceland's, yet the US still had a significantly higher infant mortality rate. Ryan is now going to delve into some other potential variables that may be affecting these results.
So now that we know the US has the worst overall child mortality rate compared to these OECD countries, the question of focus becomes why? Since our Gapminder graph only allows us to compare two variables at a time, we must consider the possible variables not accounted for that are influencing infant mortality rates. One possible variable that can help account for infant mortality rate is socioeconomic status. Studies have shown that poor children have worse health outcomes than middle class and wealthy children. Poverty has consistently been associated with low birth weights and premature delivery, which directly relates to infant mortality rate. This could help us explain why the U.S. has a relatively high infant mortality rate related to other OECD countries due to the high levels of income inequality.
The relationship that we see is important for us to understand, as it may uncover ways in which we can reduce the high infant mortality in the United States. By looking into the different factors that may be causing it, some solutions can be found to keep the U.S. in line with the rest of the OECD countries. It will be interesting to see if this trend continues in the near future. Thank you all for listening in, and we hope you enjoyed this week's episode.